Good afternoon, doctor. I want to start by taking a minute to thank you for sitting down with me again this week. Last week when we spoke, we discussed platelet-rich plasma and the opportunities it presents to you in your practice. This week I'm coming to you to discuss another alternative in the family of biologics known as viscosupplementation or hyaluronic acid injections. HA injections are a non-surgical alternative in the treatment of osteoarthritis, which is an increasing issue in the U.S. today. Like PRP, HA injections aim to treat the pathology as opposed to simply treating the symptoms like many alternative treatments out there today. HA injections have been around since 1997 in the U.S. and since that time have really increased in popularity due to an aging population that's determined to keep up the active lifestyle that they've grown accustomed to. If you want to illustrate the opportunity that's out there with the use of viscosupplementation as a treatment for osteoarthritis, you really just need to look at the numbers. In 2010, 15.4 million patients were treated for osteoarthritis in the U.S. Of that 15.4 million, only 10% were treated with viscosupplementation at some point. Now that means all these patients that were diagnosed with osteoarthritis were treated with either non-surgical alternatives such as NSAIDs, cortisone shots, or physical therapy, which have shown a poor track record of effectiveness, or they were treated with more invasive treatments such as total joint replacement. Viscosupplementation aims to fill that gap between the less invasive and the more invasive treatments. Now, to understand how HA injections work, we must first understand a little bit about osteoarthritis in general. Now, in a healthy joint, you have cartilage and synovial fluid, which work together to provide a zero friction environment in the joint and allow for fluid movement of that joint. As osteoarthritis progresses, we see a breaking down of that cartilage as well as a diminishing of both the volume and health of the synovial fluid within the joint. When this occurs, the patient's usually going to experience pain and stiffness as well as inflammation of the joint. Now you ask, how do HA injections work? HA injections work by replenishing that diminished synovial fluid from osteoarthritis. By doing so, they're going to reduce inflammation both in the fluid and in the joint in general. They're going to provide pain relief as well as restore elasticity and viscosity of the synovial fluid. Now, although the synovial fluid that's introduced into the joint by an HA injection is only present within the body for 1 to 2 days, the positive effects from an HA injection can be seen for up to 6 months. This means that not only are we replenishing that synovial fluid that's diminished from osteoarthritis, but we're also tricking the body into producing that synovial fluid on its own and restoring its own viscosity and elasticity to the synovial fluid. So again, it's not just treating the symptoms, it's getting down to the core issue, which is diminished synovial fluid. Now, I've gone over a little science of osteoarthritis and how HA injections work. Now let's discuss a little bit about how HA injections can be a positive asset to your practice in general. Now, just like PRP, there are three main benefits to your practice by switching to using viscosupplementation as a treatment for osteoarthritis. First, it's going to keep you on the cutting edge. Again, just like PRP, it's going to show your patients that you have the newest, most cutting-edge techniques for treatment of a variety of issues, but in this case, osteoarthritis. Secondly, it's going to increase your revenue stream by providing a separate revenue stream for the treatment of osteoarthritis with viscosupplementation. It's going to provide a hedge against any unforeseen movements in the healthcare market now that we're diversified our revenue streams. Finally, and again most importantly, you're going to foster client relationships. You're going to provide a full continuum of care from PRP to viscosupplementation to, if it comes to the point where the degeneration of the joint is so bad, you can provide a total joint replacement as well. But you're going to show your patients that you're not only you're not strictly looking to provide a surgical alternative, you're looking for what's in their best interest. You're going to look for the least invasive alternative that's going to provide the best results, and with HA injections and PRP in your arsenal, you're going to be able to do that very effectively. And we've discussed a little bit about the science and history of HA injections, as well as how HA injections can benefit you as a doctor and be an asset to your practice in general. Now I'm hoping next time you have a patient that comes in with and displays some issues with osteoarthritis, you'll think of us at Empire Surgical as your HA provider. Can I count on you to think of us next time you have a patient in the office that is looking for treatment of osteoarthritis?